In today's video, I'm going to talk about the concept or the diagnosis of pneumonia. And I've given videos about pneumonia vaccines and kind of debunk why they don't prevent pneumonia, but I'm going to talk now more about the general concept. So what does pneumonia actually mean? What it means is something is in your lungs, infection, inflammation. There's something that is interfering with the way the lungs exchange oxygen. And how do you diagnose pneumonia? By looking on a chest x-ray and seeing what we would call an opacity or an infiltrate, an area that should be black on an x-ray because of air is now basically occluded by something or opacified by something, whether that's pus from an infection or something else. It can be determined at a later stage, but that's what pneumonia actually means. And pneumonia can be caused by lots of things: bacteria, viruses, fungi, parasites, worms. But when you think about pneumonia, the most common thing that people think about are bacterial pneumonia. And bacteria like pneumococcus, bacteria like Haemophilus, as well as other streptococci are major causes of pneumonia. And that usually merits antibiotic treatment. Viral pneumonia, which is actually more common than bacterial pneumonia, doesn't. So, for example, the common cold virus, rhinovirus, is the most common cause of community-acquired pneumonia. But most of those people are going to get antibiotics because there's this idea that's somewhat true, that sometimes a secondary bacterial infection might be present as well. And it's very hard to get a specific diagnosis, especially if you're in an emergency department. People can't cough things up to get a sample to be able to tell exactly what's going on here. So we sort of use other clinical markers, blood work, to try and determine whether something is bacterial or viral. And there is a lot of inappropriate antibiotic use here, but it's mostly to hedge the fact that secondary bacterial pneumonias can be very serious in someone with a viral infection. So for example, someone with influenza could get a staph bacterial infection and have a very severe course. That actually was the leading cause of 1918 influenza deaths, were secondary bacterial pneumonias. So that's what pneumonia means. And people use the term without actually defining what they know, what they mean about it. They understand it's something to do with the lung. They don't understand how it's diagnosed. They don't understand that viruses and bacteria, as well as other things, can cause them. But it is a really, really common infection. It's a leading cause of death and is something that can be exacerbated by viral infections. But the pneumonia vaccine is more about preventing systemic spread of a pneumonia into the bloodstream rather than preventing pneumonia. Hopefully that's useful.